So, thanks very much for having me. I did have some speaking notes, but Glenn seems to have covered most of them, so we might take a little bit of a flyer. First of all, most of you may have seen me before. For those of you who don't, Commercial Director, Department of Health. Basically, that's anything to do with money that doesn't include accounting. So that's our companies, our ventures, our seed funds, our investments, our PFI programs, usually gets a few boos, the things we sell, the things we spin out, procurement, contract management, commercial policy, income and growth, and our estates, the whole estates program. Rather a large portfolio, I'm afraid, and that means I tend to run around in circles. What else am I? Well, I was very pleased to see the flags up there earlier on. I'm also People's Republic of Cornwall. Very proud of it. I think that makes us an official minority these days. EPROC, GS1, PEPL. It's great to see so many people here. It's great to see that this is really moving forward now. It's been a slow gestation. Owen and Steve, who stood up just now, have pushed and pushed to get this off the ground and to take it forward. They've done a fabulous job. It's taken a lot of patience. Trying to get things moving through the DH is never easy. Many of you will be aware of that. Trying to get things moving in a time when there's no money and we're in austerity mode makes it even worse. But they've done a great job in getting this program moving. I came on board a little bit before Glenn guessed, January last year, and I was actually walking the corridors a couple of months beforehand. So actually from the point where the letter went up from Richard Douglas on forward. GS1 when I came on was, what is that? Sounds a bit odd, okay? It was a very small part of the portfolio. But moving forward and looking to the future, the whole GS1 rollout, the world we're going to get ourselves into, and it's not going to happen overnight, but the world where we can actually track and trace all the way through, be it medicines, be it products, be it patients, the world where we will have detailed, data-rich information on patients, on outcomes, on correlations, the world where we actually know everything we've bought and where it sits in the supply chain, where it sits in inventory, and we can actually manage our inventory properly. We don't have to keep throwing things away because they're out of date. That is the world we need to get our health service into. That is the world where we are actually going to start operating more efficiently, and we can take a lot of money out of the system. Okay? I know it's very close to all of us at the moment, the deficits, the budgets. The system is under great, great strain, and as is UK PLC to some extent. But there is a lot of money washing around in our health service, a lot of money that is just wasted, that could be going to our patients, could be going to frontline services, could be buying that new MRI scanner. And this program is one way, and a very big way, of liberating some of that cash, improving productivity, reducing inventory, giving us better control over what we purchase, getting us better deals. It is incredibly important. Where are we overall? Okay. We've got a demonstrator program on the go. Some of you are involved in it. I have to say I was incredibly impressed when we launched the idea of a demonstrator program, and frankly we went round and round the houses in DH many times with Steve pulling what little's left of his hair out. It was all about me saying you can't spend that much money. That's far too much money for a program. There's no way I'm ever going to get it past ministers. And we came up with the demonstrator approach, and we asked people to nominate and bid and come in to be part of the demonstrators. And I was so impressed with the responses. 154 acute trusts. We had 120 nominations. At the time, for the deadline, for the cut-off, we had 43 submitted plans. 54 have plans now. 29 formally applied for what were only 6 slots. 12 were shortlisted, 6 are now up and running, funded by DH. Okay, another 6 are actually going ahead themselves, self-funding. Okay, that's an incredible response. That's way more than I or anybody else had expected. And that's putting propositions together and putting them into DH with executive backing. Okay, that's not the normal sort of process we see for what's frankly a backwater, procurement. Okay, it's not normally seen as being that visible. And it was great to see that level of engagement. It was great to see that level of activity, of enthusiasm, and of course, rather more difficult to handle, the people who didn't make the shortlist weren't particularly comfortable about it. And it was very sad having to say, sorry, we've only got so much money available for the demonstrators, so we can only put 6 through. Okay? The 6, as we all know, hopefully, Salisbury, Derby, Plymouth, North Tees, Cornwall, Leeds. No bias from my point of view on that one. I did have representations from a few people that had to be politely pushed away. But it's great. We're at the start of a journey. It's going to take a while, but we're off and running. Okay? Perhaps a little more concerning from my point of view is we've got a bunch that are up and running, and a bunch that have plans, and a bunch that want to move forward. We also have 34 trusts who aren't engaged at all. Okay? And we have 67 who we politely classify as with leads, which means that they've been identified, but they're not really doing very much. Okay? So that's about 2/3 of the trusts are not really engaged in this program yet. 1/3 are in the vanguard, are moving forward. Great. But we need to start moving some people out of that trailing 2/3 to getting on the train, getting with the program. I'm going to come back to that one in a minute. Okay? The demonstrator sites are very, very key for us. They're key because they're the way that I get to be able to release money and turn the tap on again. Okay? Doing these programs is not cheap. Yes, the payback is fabulous. The returns are very quick. But it still takes money. It takes money for systems, it takes money for scanners, it takes money for change management and training. Okay? The finger in the air number is roughly for an average trust. Not that there really is an average trust, but it works from the numbers. An average trust is about 2 million. Okay? That becomes quite a large number when you add it all up at a time when we don't have any money. So the demonstrators are particularly important because they are going to prove that we get value for money. They are going to prove the payback and the cash flow savings. Demonstrators are due to run through till the end of next year. I do not intend to wait till the end of next year to be able to start cashing those savings, so to speak. We should see early signs of savings later this summer. But certainly by the end of the year, I would hope that we've got documentable savings that we can start building cases to get more money out of the system, to start more people implementing. Okay? But that's why the demonstrators are so important to us. Excuse me. All in all, this is a marathon program. It's taken Steve and Owen quite a long time to get it off the ground. It's taken a long time to push it through and get funding from the department. And it's going to take a while to implement and get the demonstrators to demonstrate value for us to then go back to ministers to get yet more money to roll it forward. Okay? And then we've got the implementations, and we've got 154 acute trusts. It takes time. This is a 5-year program or longer. Probably more like 7 or 8 by the time we get all of them in. Okay? We're going to need tenacity, we're going to need patience, and we're going to need to work together. We're going to need to share the experiences, share what we learn, share where we get the savings, and in particular, share the mistakes. We will be making mistakes along the way, whether it's in the demonstrators or whether it's in DH. We will all be making mistakes. We have to fess up to them, we have to share them, we have to learn from them. So I ask you to be brave about that. Don't hide them. Okay? Key to making this work is sponsorship. executive sponsorship in the boardroom. Having your chief executive on board, your finance director on board, having them close and engaged, making them aware of how much money you're going to be delivering to them for them to deliver back to the frontline services. Okay? Keep them close, keep them on board. They have the ability to bang on doors, bang on ministers' doors, make things happen if things are getting blocked. A couple of things I'd like to finish off with. So this is a fairly short, sharp start. Number one, this is about savings. This is about liberating money that is trapped in the system, money that is wasted in the system. And it's large amounts of money. Okay? Finger in the air, we'll say it's $1 billion. I expect it to be much more than that, but I don't want to overpromise and underdeliver. That's $1 billion per annum. That's a lot of money we can flow back to the system, particularly at a time when the system is in such cash crisis. Unfortunately, it ain't going to happen in the next 3 years. And the real cash problems, as we all know in the system, are here now, today. Second one, and this is by no means less important, is harm reduction, as you saw from Jeremy's little video just now. Question to the audience. Who can tell me what the size of our litigation liabilities or litigation bill is for damage in the health service? Any guesses?
Billion. 1.4.
Anyone else?
6.
Okay. We have close. 1.4 was what we spent year ending April 15. Okay. That was cash out the door just to actually pay settlements that year. Okay. This year it'll be much larger. It's growing, not quite exponentially, but it's growing very rapidly. It's growing because we have more activity in the system, more work going on. It's growing because people are making more claims. We're adopting rather an American style of culture, an awful lot of people making claims whether they're legitimate or not. And it's growing because the size of the claims are bigger in each instance. They are getting bigger awards. As of last year, the liabilities we have booked for claims are £28 billion. Okay? When the accounts are published for this year, it will be a massive, massive increase on that number. Okay? And that number is caused because of harm in the system. Now, this is not going to reduce, GS1 is not going to take out harm in the system. We're always going to have harm, we're always going to have accidents somewhere. But it will make a big difference. When we have a fully implemented track and trace, we'll be able to pick up the examples Glenn was talking about earlier on, about the accidental wrong drugs going into somebody, about the accidental cutting off of the wrong limb. These sorts of things cost us a lot of money, and frankly, it's also not particularly good for the patients. Okay? So we have a lot of opportunity to improve the patient experience, reduce the level of damage, reduce the cost that imposes on the system, and the ongoing cost of correcting those damage incidents. Okay. What else can I say? That's probably about it for me. What I want from all of you is evangelize, enthuse, lead, share. Okay? Let's get everybody with the program. It's amazing to see how the program has grown. It's amazing to see how many people are in here. We've got standing room only. We've been turning people away. That's fabulous. Okay? But as I said earlier, we've only got about 1/3 of the trusts engaged so far. It is a long journey. We've got a lot to do, but the size of the prize is enormous, both for the patients and for the finances of the system. And if we can improve the finances of the system, that makes all of our lives a better place to work. Okay? That's it from me. Thanks very much, and we'll be doing questions later, I think.